Case number 5. A 9-year-old child with asthma experiences a significant worsening of symptoms during the winter. The family lives in a small apartment with a wood-burning stove for heating. The child's symptoms include frequent nocturnal cough and increased use of a rescue inhaler. What environmental factor is most likely contributing to the exacerbation of the child's asthma? The cold air exposure. B. Exposure to wood smoke. C. Indoor dust mites. D. Lack of physical activity. Correct answer B. Indoor air pollution, particularly from wood fires or pellet stoves, can exacerbate asthma symptoms. In this scenario, the use of a wood-burning stove in the child's living environment, especially during the winter months when the child's symptoms worsen, points to exposure to wood smoke as a key contributing factor.